Here is your question. Right. So if you have read and understood, considering it critical care scenario, please tell me how would you manage this patient now?
Okay, ma'am. So we'll manage the patient according to the ABCD care of surgical critically ill patient care. So
Yes.
we'll see the ABCD management. We'll see the airway. We'll talk to the patient if he's able to talk or not. Then we have to see the breathing. How is the respiratory rate? How is the pattern? And then we'll go for circulation. We have to open 2 wide bore IV cannula. We have to start warm crystal white fluid.
Yes.
Then we have to check the other vitals, blood pressure, pulse, and then we have to, as the patient is, we can say, is a hypothermia. So we have to wrap the patient with a warm blanket. Then we have start Hager's warmer machine.
Okay. Considering the fact that patient, you are the receiving doctor or receiving physician in A&E. So can you tell me how would you define normal core body temperature?
Okay, if the body temperature is less than 35 degrees Celsius,
Yes.
then we can say is the hypothermia.
Yes. So is there any way you can measure body temperature?
Okay, so we can measure the core body temperature. We can take oral temperature, rectal temperature, and then otic temperature.
Axillary and temperature.
Axillary.
Okay. And even occipital. Okay. Can you tell me what might be the causes of hypothermia, not just particularly in this case, but in general?
Okay, in general, maybe if the patient is a prolonged operation,
Yes.
if the theater temperature is not maintained, hypovolemic shock or hemorrhagic shock,
Yes.
like ruptured aortic aneurysm,
Yes.
or any other
Massive blood
cause,
loss.
massive blood loss.
Yes.
Yes.
All right, good. Just suppose you are trying your best to manage this patient, but you don't successfully manage. What are the complications that you suspect to see?
Okay, so for cardiac, maybe cardiac arrest, cardiac arrhythmia.
Yes.
Then in respiratory, maybe respiratory failure, hypo volemia. I mean what we call. Low respiratory rate.
Yeah. Decreased ventilator.
Yeah, decrease hypoventilation.
Drive.
Yes. And then in
In case of-
periphery, maybe
yeah.
vasoconstriction, very
Yeah.
cold calm periphery. So decrease systemic vascular resistance, decrease venous return, and cardiac failure as well.
Yes. All right. You know you've taken the ABGs of this patient, and as you could see, patient has hyperkalemia and lactic acidosis. How would you correct this
Okay, so the patient is having
deficit?
severe hyperkalemia. Potassium is 8.5 millimole. So we
Yes.
have to start with calcium gluconate 10 millimole over 10 minutes.
Yes.
And then we can give 50% dextrose with 10 unit of extra, insulin. Then we can go for salbutamol infusion or salbutamol nebulization, and then we can give sodium bicarbonate infusion.
Okay. Right. Considering the fact that during prolonged surgeries, patient can also undergo hypothermia. So can you give a few ways, or can you mention few ways in which a patient can be kept warm intraoperatively and postoperatively as well?
Okay, ma'am. So intraoperatively, we have to maintain the temperature of the theater
Yes,
at least more than 21 degrees Celsius.
yes,
Then we have to drape and prep the patient well, not expose the unnecessary area.
yes,
And then warm IV fluid.
yes.
Then post-operatively, we can cover the patient if we like, and try to minimize the blood loss intraoperatively. And then post-operatively, we can use still that IV fluid. We can cover the patient with a different blanket. We can use like wool blanket, then maybe a space blanket, and we
Okay.
can use that Hagar machine, warmer machine.
Yeah. Can you tell me how do normal people generate heat?
Okay, there are 4 different way we can. Is radiation, evaporation, and conduction, and the other one is convection.
Yeah. Would you like to describe any one of these?
Okay, so maybe for conduction, direct transfer to the heat
Yes,
to operating table and cold infusion fluids.
yes.
And the evaporation is an open wound, like abdominal wound. It will evaporate some heat.
Okay. Right. What I had to ask you more. All right. Where would you think this patient should be managed?
So this patient, I think, is better to manage in ITU.
Okay. What are the risk factors, or according to the NICE guidelines, how do you reduce the risk of hypothermia?
Risk of hypothermia. Okay, ma'am. So we can maintain the temperature
Yeah.
in theater. Then we
Not
can cover the.
necessarily in theater environment, but in surgical patients.
Okay, yeah. Even in post-op patient or even
Yeah.
in ITU, we have to maintain the temperature. Then we have to cover the patient with the blankets. We have to give warm IV fluid, and maybe intraoperatively, if we want to do some operation intra-abdomen, we have to wash the abdomen with warm saline. Then we can use that Bayer Hagar warmer machine, and
Okay. What
we can
else?
monitor the patient like ECG, ABG, and other monitoring.
Right. Can you tell me, the extrinsic causes of hypothermia? Can you mention few?
Extrinsic cause, if the patient is exposed in the
Cold environment,
cold environment,
yes, or
in the water,
yes,
and
below, yeah, below bearable temperature, yes, or another could be massive blood transfusion.
massive blood
Even
transfusion,
in
then any
organs in which,
hypovolemic shock, or maybe any cause of trauma which has to lose a lot of blood.
yeah, so good. Right, this was hypothermia. Good. All right, thank you.